I'm clearly visible, audible. Without wasting any time, I will start the lecture here. Just few seconds more. Okay. So I hope I'm clearly visible and audible to you people. So I welcome you all for today's session. I am Dr. Priyanka Sachdev here, medical entrance educator on an academy. And today I am here to continue my pharmacology series. So this series I have launched basically for FMGE targeting students this December FMG, those who are targeting. So I will be a little bit faster in completing the whole syllabus. And I have started Patho, Pharma and Microbiology free batch for these students. And this is pharmacology class. We have just completed microbiology class. This is pharmacology class. In pharmacology, we have started antimicrobials yesterday. So yesterday, we have seen the general considerations of antimicrobial drugs. Of antimicrobial drugs, we have already started yesterday. We have seen the general considerations yesterday. Yesterday, we have seen three drugs, three chapters, sulfonamides, trimethoprim and quinolones, the fluoroquinolones. Done. Fluoroquinolones. So today I am starting the drugs that is protein synthesis inhibitors. So I teach antimicrobials in a very unique way. Those who are my old students, they already know my way of teaching. I ask you to make comparative tables. So today I am going to teach you these 10 drugs. So these all are protein synthesis inhibitors. From these 10, the most important on which most of the MCQs are asked are these four. That is tetracycline, chloramphenicol, aminoglycoside, and macrolide or erythromycin. Erythromycin will be the prototype from macrolide. So TCAE. I am going to teach you these four in much detail. Expect one MCQ from this portion. It is a very important portion for your MCQs. And these 6 are also protein synthesis inhibitors, but not really very important. You should have an overview of these, but not the details. So without wasting time, I will start the details of these 4. I asked you to make a comparative table between these 4 as usual. So we will start it. But so I will give you the detail of these 4. All of them are protein synthesis inhibitor. So listen. Before starting protein synthesis inhibitor, you should understand how protein synthesis takes place. What are the steps in protein synthesis? You have already studied this in biochemistry, I know. But in the first 2 minutes, I will teach you the steps of protein synthesis, transcription and translation. Then I will teach you each of these antibiotic is inhibiting which step. All of them are protein synthesis inhibitor. I know you know very well. But which step of protein synthesis is inhibited by each of them? The step is different for each of them. So before understanding each of these drugs, you should understand the steps of protein synthesis. In protein synthesis, there are 2 steps we all know, transcription and translation. What do you mean by that? Listen, transcription is formation of mRNA from DNA. This is DNA, DNA से mRNA बनना is transcription और mRNA से protein बनना is translation. That you already know in biochemistry, I know. So transcription and translation you already know, understand it. This is a bacterial cell. This is not a human cell. This is the bacterial cell. Can you see the cell? Yes, of course, you all can see. This is the nucleus of the cell. Inside the nucleus, this is the DNA of the bacterial cell. So this is a bacterial cell. You can see the nucleus. You can see the DNA. How protein synthesis will take place inside this bacteria? You tell me how it will take place. How it will take place. First, the 2 strands of the DNA will be separated. Unwinding takes place. The 2 steps will be separated. So one will be the leading strand. One will be the lagging strand. You know, one is leading, one is lagging. So the 2 unwinding will take place. Then starting from leading strand, on the leading strand mRNA will be formed. Can you see mRNA? So mRNA will be formed. So this step is known as transcription. Transcription is formation of mRNA from DNA. So complementary will be formed. So you know adenine forms double bond with thymidine and cytosine forms triple bond with guanine. You already know the basics. I'm not repeating it. I know it is a wastage of time. But if you understand these basics now, you will have a better understanding which step is blocked by which antibiotic. So you can see the complementary mRNA is formed and transcription is over. Now this mRNA will move out of the nucleus into the cytoplasm. You see transcription is over. So from DNA, we have already synthesized mRNA. This is DNA. From DNA, mRNA is already synthesized. Now this mRNA will go out in the cytoplasm for formation of protein. So this mRNA moved out in the cytoplasm. In the cytoplasm, there is a ribosome. Ribosome have 2 subunits, 50S and 30S. This is a 70S ribosome. This is sedimentation rate. So 50S and 38. And at the junction of which 2 windows are present, P window and A window. You can see P window, you can see A window. Let me zoom it out. And this mRNA is going out from the nucleus into the cytoplasm and binding with the first codon binds with the P window, the second codon binds with the A window. You have to understand this windows in detail. Let me zoom out this ribosome and mRNA for you. So this is the ribosome. You should understand this ribosome. Ribosome have a 30S unit. Ribosome has a 50S unit. You can see 50S and 30S. And it has two windows, P window and A window. Now this mRNA is coming from the nucleus into the cytoplasm. You can see mRNA is binding with the ribosome. mRNA has codons. A triplet of 3 nucleotides is known as codon. You know, there are various codons. Total we are having 64 codons out of 20 amino acids. 20. There are 4 nucleotides, 20 amino acids, and we have 64 combinations. So UAC, UAG, you know, multiple. I'm not teaching you biochemistry. So this is codon. Codon is a triplet of the nucleotide. We know. So the first codon bind with P. You have to understand these steps now, huh? Without understanding these steps, you can't understand mechanism of action of tetracycline, erythromycin, aminoglycoside, and chloramphenicol. So you have to understand these windows in detail. The windows are a little bit difficult, huh? You can see the first codon is binding with P window. You can see the C2. C2 is the second codon. It is binding with the A window. So first codon binding with P window, second codon is binding with A window. So let me give you an overview in the cell. This is a bacterial cell. What is happening? mRNA is already formed. This mRNA moved out. This mRNA is bind with the ribosome. This is the first codon. This is the second codon. As I have told you, all codons, one codon stand for one amino acid. These all are standing for phenylalanine. These are standing for serine. These are standing for proline. These are for threonine. So each codon for one amino acid. There are 20 amino acids. All the amino acids you can see they are present in the cytoplasm. So this is amino acid number 1. This is amino acid number 2, number 3, number 4, number 5. All 20 amino acids are present in the cytoplasm. How they are present in the cytoplasm? In the cytoplasm, they are present over tRNA. tRNA. tRNA is the transporter RNA. tRNA. They are present over tRNA is their rickshaw, auto rickshaw, in which they are present and they will move from here to there in the cytoplasm. You can see all of them, all 20 amino acids are present in the cytoplasm on tRNA. tRNA. Give me a thumbs up if you got it. So depending on which codon is there, the first codon, here is the first codon, you can see C1. C1. So C1 standing for which amino acid, that we will give a call. So just suppose the first is always AUG for methionine. So AUG, the amino acid which is holding good for AUG, please come here. We will do an announcement. So the first amino acid will come from the cytoplasm wherever it is present. It will come to the ribosome and translation is starting. Now there are 4 steps. 4 steps. You have to learn the 4 steps of translation one by one according to the windows. So the 4 steps will be blocked by 4 antibiotics. The first step will be blocked by tetracycline, second will be erythromycin, third will be chloramphenicol, then aminoglycoside, likewise. So 4 antibiotics blocking the 4 steps. You have to understand these 4 steps. So this is the first step. The first step is initiation. Initiation means the first codon. Just suppose it is AUG. It can be anything. Usually it is AUG. So the first amino acid will come and bind at the P window. So this is AUG, the first codon. It can be anything. It is not necessarily AUG. The first codon at P window, the corresponding amino acid for that codon will come on the tRNA along with the tRNA and bind with the P window. This step is known as initiation. Give me a thumbs up. The first step is initiation. What is the next step? Next step, you can see the next codon C2 at A window. Now it will give a call. So second amino acid which is corresponding to this codon, just suppose it is UAA. Now UAA is for serine, for proline, I don't know what it is. So whatever it is holding good, that amino acid will come and bind to the A window. This step is known as second step, attachment of new amino acyl tRNA on the A window. So this is the old one and this is the new one. This is the new one. So the first step is initiation and the second step is attachment of new amino acyl. Amino acyl means amino acid. Amino acyl tRNA means amino acid on the tRNA on the A window. This is second step. Give me a thumbs up, everyone coming on the third step. This is the pre-existing one, old one. This is the new one coming on the third one. Bond will be formed between the two. Between the pre-existing and the new, peptide bond will be formed. Peptide, and look at the direction of the arrow. The pre-existing will move towards the new. New will not move towards pre-existing. Look at arrow. So this will happen. So the third step, peptide bond formation between the two and newly attached amino acid between the two, and then there is shifting of the pre-existing to the new. Shifting of the pre-existing to the new. Give me a thumbs up. That is shifting, transfer of the pre-existing to the new. That is known as P to A transfer. Here P to A. From P it is going to A. So from P it is going to A. P to A transfer takes place. So the third step is P to A. Peptide bond formation and P to A. Give me a thumbs up. Everyone give me a thumbs up. The fourth and the last step, the whole ribosome. Can you see this ribosome? The whole ribosome will move ahead. It will do alta-pulti, flip-flop, and it will move ahead by one window. So this assembly, it is on A window now. Now, if the ribosome will move like this, imagine the ribosome is moved like this. So this assembly will come on P. So this whole assembly will come on P. The whole assembly, and यहाँ पे ribosome खसक गया. So C1 is empty now. Here it was C1, C2. Now it is C2, C3. Can you see the ribosome ऐसा खसक गया? So it is known as A to P shift. A to P shift. So this is known as, the last step is known as translocation. So there are 4 steps. That is A to P. The fourth step is A to P. The third step was P to A. Give me a thumbs up. These are the 4 steps. So there are 4 antibiotics. Each one of them will block one step of translation. These are the 4 steps of translation. Tell me the 4 steps. Who will tell me the 4 steps? We have 4 antibiotics. Let's talk tetracycline. I will write tetracycline as T. I will write chloramphenicol as C. I will write aminoglycoside as A. And I will write macrolide erythromycin as E. So I have given one letter to each of them. See, the first step is initiation. Initiation is blocked by aminoglycoside. So aminoglycoside is blocking initiation. Initiation will not happen. If I take a tablet of aminoglycoside or an injection of aminoglycoside, that aminoglycoside will go inside, and this is the bacteria. Inside the bacteria, initiation step is blocked by the aminoglycoside. So if initiation is blocked, the bacteria cannot synthesize protein. So bacteria cannot divide. Bacteriostatic drug. Aminoglycoside is a bacteriostatic drug. So it is inhibiting initiation in the bacterial cell. Give me a thumbs up. That is the mechanism of action of aminoglycoside. The first step. The second step is attachment of a new amino acid on the A window. This step is blocked by tetracycline. So tetracycline blocks the second step, that is attachment of new amino acid on the A side. That is second step is blocked by tetracycline. Second step is blocked by tetracycline. So if I am taking a tablet of tetracycline, it is going inside my body, absorbed in the blood, going to the bacterial cell. Inside bacterial cell, it is blocking the second step of translation. So bacterial cell cannot form protein. So bacterial cell cannot divide. So it is bacteriostatic. Again, give me a thumbs up. This is second step. The third step, that is P to A shift. Formation of peptide bond, and P to A. Pre-existing will move towards the new. That is P to A shift. P to A shift. The third step is blocked by chloramphenicol. So chloramphenicol is blocking the third step. The third step is blocked by chloramphenicol. That is P to A wala. That is peptide bond formation and transfer of pre-existing to the new. This step is blocked by chlor. So if I am taking a tablet of chloramphenicol, it will go in my blood, and inside my blood it will go in the bacteria, and the bacteria it will block the third step. So this bacteria cannot form protein, it cannot divide. So that is the mechanism of action of chloramphenicol. And the last one is erythromycin. So it will, the whole ribosome will translocate ahead. So C1, C2 free हो गया, अब C3, C4 पे पहुंच गया. So the fourth step is translocation, that is A to P. The fourth step, that is blocked by erythromycin. So erythromycin is blocking the last step, that is flip-flop of the translocation, that is blocked by erythromycin. So if I take a tablet of erythromycin, it will go inside the blood, inside the bacteria, it will block the fourth step. So again, bacteria cannot do the protein synthesis and it cannot divide. So all of them, you can see the diagram, beautiful diagram of KDT, which I have decoded for you. So you can see this drug. What is this drug? So the first drug is aminoglycoside. It is inhibiting the initiation step. The second drug is tetracycline. It is inhibiting the second step. The third step is the drug is chloramphenicol. It is inhibiting the third step. And the fourth is translocation inhibiting, that is erythromycin. So see the 4 drugs, A, T, C, E. You can learn like this. Step 1, step 2, step 3, step 4. You know the 4 steps. Give me a thumbs up. So I will teach you all 4 one by one. I always ask you to make the comparative tables. If you are not willing to make this comparative table, now there is no use of attending my lecture. It is just wastage of time. So take a notebook, take a pen. If I am saying you with such a confidence, there is something in this now. There is some weightage in this thing. Done. So take a notebook, take a pen, just make this table with me. At the end of the lecture, you will realize, yes, ma'am, this is the most worth thing I have learned today. So that is the thing. So please compare it. Tetracycline, chloramphenicol, aminoglycoside, erythromycin. I will ask you to make a comparative table between the 4: introduction, classification, bacterial spectrum, mechanism of action, resistance, adverse effect and uses. For adverse effect and uses, I will give you 4 mnemonics, total 8 mnemonics. So I will give you mnemonics for that. So please start. Everyone give me a thumbs up. So in this sequence, I'm going to teach you. I'm starting the first chapter, tetracycline. So I will teach you 4 chapters now. If you got the introduction, have you got the introduction? This thing is clear to you. This was the introduction. So mechanism of action you already know. You already know mechanism of action of each of them. So tetracycline is blocking the second step. Chloramphenicol is blocking the third step. Aminoglycoside is blocking the first step, that is initiation, and erythromycin blocking fourth and last step, that is translocation. So you know which step of translation each of them are blocking. So you know the mechanism of action already. Let me move ahead. फिर से बताऊंगी जब मैं each individual बताऊंगी. Everyone give me a thumbs up. Everyone, if you like it, if you like, I'm simplifying it up to that level ना कि किसी blind person को भी समझ में आ जाए. इतना simplify करके मैं पढ़ा रही हूँ. Done. So I'm starting with the first chapter, tetracycline. So write in the introduction why tetracycline are known as tetracycline, because in its structure it is having 4 links, 4 rings. So 4 benzene rings are there. That's why known as tetracycline. It is obtained from actinomycetes. Again, important MCQ. It is obtained from actinomycetes. So write down in the introduction, draw the 4 rings here. It is known as tetracycline, and write here actinomycetes. It is obtained from actinomycetes. Write down here. Introduction is over. Coming on classification. Classification, tetracyclines are of 3 types. Group 1, Group 2, Group 3. Tetracycline is an umbrella term. उसमें tetracycline नाम की ड्रग भी है. Tetracycline ग्रुप में tetracycline ड्रग भी है. So tetracycline, chlortetracycline and oxytetracycline. So tetracycline, chlortetracycline, oxytetracycline are group 1. Group 2, demeclocycline and lemicycline. Demeclo and lemi. Group 3 is doxy and mino. Doxy and mino. ये demeclo है, ये doxy है. Don't get confused. So there are 3 groups. 3 plus 2 plus 2. 3, 4, 5. Total 7 drugs are there. 3 plus 2 plus 2. You should know the names. Group 1, Group 2, Group 3. You should tell the names again and again. So Group 1 में there are 3 drugs. Tetracycline, chlortetracycline, oxytetracycline. Group 2, demeclocycline, lemicycline. Group 3, doxycycline and minocycline. So we are done with the 7 drugs. Coming on spectrum, it is a broad spectrum. It kills everything, everything. How many bacteria you know? There are 4 types of bacteria: gram-positive cocci, gram-negative cocci, gram-positive bacilli, gram-negative bacilli. It kills all. It kills all. Apart from it, it kills rickettsia also. Apart from it kills chlamydia also. Apart from it kills mycoplasma also. Apart from it kills some protozoa also, bacteria के अलावा. So it is the broadest spectrum, you can say. See the spectrum? It is killing all cocci, gram positive, gram negative, both. It is killing all bacilli, gram positive, gram negative, both bacilli. It is killing spirochetes also, rickettsia also, mycoplasma also, actinomycetes also, and some protozoa also. So that is the spectrum. That is the spectrum. So write gram positive cocci, gram negative cocci, gram positive bacilli, gram negative bacilli, spirochetes, rickettsia, mycoplasma, protozoa. So it is having a broad spectrum. Please write it down so you will have a better understanding of the other 3. If you compare it, please do it. Please, that is a request. That is a request you say, or that is the order you say, whatever it finds suit for you. So please write it down. Huh? Coming on mechanism of action. Who will tell me mechanism of action? I have already taught you in the beginning. Mechanism of action चारों का एक साथ बता दिया है. Who will tell me mechanism of action of tetracycline? Which step it is blocking? It is blocking, of course, protein synthesis का translation वाले step. Which step? There are 4 steps now. Write down the number of steps. Tetracycline block which step? Tetracycline block which step? Yes, I'm asking to you. Write down in the chat box. Yes, you are right. It is blocking the second. Tetracycline inhibits protein synthesis. We all know. But which step? Which step? So tetracycline blocks the number second step. This wala step. So it is blocking the second step, that is attachment. So the initiation is okay. Initiation is already there. Initiation is already there. After initiation, when new amino acid, initiation occurs at T window and new amino acid comes at the A window. But new amino acid at the A window, it is blocking. So it is acting on the A window. See the cross. See the cross here. So it is blocking the A window so that new amino acid tRNA cannot come on the A window. So blocking the second step, it is inhibiting protein synthesis. Now for each of these drugs, each of the 4 drugs, you should learn the ribosome ka fragment on which it is acting. Tetracycline acts on 30S. So some acts on 50S. Aminoglycoside will act on both 30S and 50S. So one by one I will teach you that segment also. So that segment here is 30S. Tetracycline bind to 30S segment here and block the A window. So on 30, it will come via 30S and block the A window. So learn this 30S also. 30S also. So it will bind to the 30S and inhibit the A window so that new amino acid tRNA cannot come and bind with the A window. So second step is blocked. So peptide chain will not form. So peptide chain will not form, new protein will not form. So bacteria cannot divide. Bacteria will not die, but it will not divide. So it is bacteriostatic. It is not bactericidal. So you know, transcription is already over. mRNA is formed from the leading strand. This mRNA is coming out, and here on the ribosome, the initiation is already over. But for elongation of the chain, new amino acid cannot come on the A window, and this cannot form new protein. So this bacteria cannot divide. The proteins which are already present in bacteria will not die, but new proteins will not be synthesized. So it is bacteriostatic. So it is bacteriostatic. So write down mechanism of action in short. Write down it acts on 30s or 50s or both. It acts on 30s. So compare with others. Others में भी मैं बताऊंगी कौन सा 30s है, कौन सा 50s है, कौन सा both है. So it acts on 30s fragment of the ribosome. Number one. What is the main step? It is inhibiting step number 2. That is, it inhibits new tRNA on A site. Binding of new tRNA on A site is inhibited, and it is bacteriostatic. So you have to write for all which is bacteriostatic, which is bactericidal. It is bacteriostatic. MCQ will come from this table only. At the end, you have to learn this table. Done. Coming on resistance. What are the mechanism of resistance bacteria will do so that it will not die with the tetracycline? Listen, this is a cell of bacteria. This is not human cell. This is bacterial cell. Now, whenever inside the bacteria, you can see protein synthesis is taking place. Bacteria is surviving, and protein synthesis, you can see here, it is taking place. I am a human. This bacteria is present inside my body. I want to kill this bacteria because this bacteria is causing disease inside me. So that's why I have taken a tablet for tetracycline. Tablet of tetracycline. This is my tetracycline. I have taken it by mouth. It is going inside me. It is getting absorbed. It is going inside my blood. From blood, it is going inside the bacteria. So this tetracycline is entering inside the bacteria. Normally, it will go to the A window, bind here on the 30S, and inhibit protein synthesis, so bacteria cannot divide. But bacteria do not want to die. Bacteria do not want to die. So bacteria will do resistance by 3 mechanisms. Number 1, for entering the tetracycline inside the bacterial cells, some transporters are required. So bacteria will alter that transporter, so tetracycline even can't enter in the cell. So decrease influx. So the first mechanism, influx ही कम कर देगा बैक्टीरिया कि अंदर ही मत आ तू. और अगर आ गया तो increase efflux, vacuum cleaner, increase efflux. So either decrease influx or increase efflux. That is the first mechanism of resistance. Bacteria is trying to prevent from the tetracycline by first mechanism by decreasing influx or increasing efflux. Number 1, give me a thumbs up. Give me a thumbs up. Number 1. Number 2, after coming, if in all tetracycline is coming inside, it will go to the ribosome and inhibit the A window. So bacteria will cover the ribosome with a protective covering. Bacteria will cover the ribosome with a protective covering so that tetracycline cannot reach here. So that is the second mechanism. Second mechanism of resistance. So tetracycline cannot reach here, cannot inhibit protein synthesis. Bacteria will not die. That is the second mechanism. Third mechanism, the most important one. Bacteria are very smart, huh? Don't underestimate them. Bacteria will form an enzyme inside the cell. That enzyme will degrade tetracycline. The name of the enzyme is tetracyclinase. That will degrade the tetracycline. So as soon as tetracycline will come in, the enzyme present here will degrade the tetracycline. So tetracycline will become inactive. So that is the third mechanism. Tell me the 3 mechanisms. What are the 3 mechanisms of resistance? Number 1, decrease influx or increase efflux. Number 1. Number 2, ribosome को protective covering दे दो. And number 3, tetracycline inactivating enzyme बना दो. Everyone give me a thumbs up. These are the 3 ways by which bacteria is trying to protect themselves from tetracycline. I want to kill bacteria, but bacteria do not want to get killed. No? I am a human. I want to kill bacteria inside me so that I do not have disease of the bacteria. But bacteria want to survive. Bacteria do not. Nobody wants to get dead. No? So bacteria want to survive. For that, he will do the resistance. So these are the 3 mechanisms by which bacteria is doing resistance. Everyone give me a thumbs up. So resistance is over. You know the 3 mechanisms. I'm not writing here. Coming on the next heading, adverse effect and uses. Write the mnemonics. I will always give mnemonics. Try to give mnemonics for adverse effect and uses. Adverse effects of tetracycline. The mnemonic is L.K. Advani is a PT teacher. L.K. Advani is a PT teacher. So L stands for liver damage. K stands for kidney damage. Advani ka A, D, V or I have used. So A, D, V, I, Advani. So A for anti-anabolic effects. D for diabetes insipidus. It is not diabetes mellitus, it is diabetes insipidus. V for vestibular toxicity, and I, Advani ka I is intracranial pressure is raised. T is phototoxicity, and T is teeth and bone. Teeth and bone with chelation in the teeth and bone. So have you got it? Either learn this or there is one more mnemonic. If you don't like this, you like Kapil Dev, I guess. So Kapil Dev to bat. So the same mnemonic. K stands for kidney, A stands for anti-anabolic, P stands for phototoxicity, I for increased intracranial pressure, L for liver. They've got D and V. D for diabetes, V for vestibular, BAT, BAT, BAT. So bone and teeth, bone and. So whatever you like, the same mnemonic is there. Only reshuffling is there. So learn only one. Don't learn two. Don't try to learn both. Huh? You will get confused. I can learn both, but at your age, you learn only one. Either you love Advani or you love Kapil Dev. So learn one mnemonic. Don't learn both. Done. So I will explain you little details of it. So liver damage, में patient will have jaundice. Patient will have fatty liver and jaundice. In kidney damage, all tetracycline cause kidney damage. In the kidney, all tetracycline cause Fanconi syndrome. It is due to the degraded products of the tetracycline. Only one tetracycline. There are 7 tetracycline. Now you know group 1, group 2, group 3. You know the classification. Out of 7, only doxycycline is safe in kidney. It do not damage kidney. So learn doxycycline. It is an exception important for MCQ. So all exceptions are important for your MCQs. So many times this question have already repeated which tetracycline is safe in renal failure. So if the patient is already having renal failure, I cannot give tetracycline to that patient except doxycycline. Doxycycline do not cause renal failure and it is safe in renal failure. Give me a thumbs up. So that is kidney damage. So doxycycline can be used in renal failure. Liver हो गया, kidney हो गया. LK, Advani का A, anti-anabolic effect. It inhibit protein synthesis na. Protein synthesis is catabolic and inhibit protein synthesis is anabolic. So if I take a tablet of tetracycline, the tablet will go inside me. It will be absorbed in my blood. So from my blood, it will go in the bacterial cell also, my human cell also. So it inhibits protein synthesis in the bacteria. वो तो अच्छा है, but it is inhibiting protein synthesis inside my human body also. So it is having a side effect of anti-anabolic effect because it is inhibiting protein synthesis inside me also, inside human cell also. Apart from bacteria, bacteria में करे अच्छी बात है, human में करे अच्छी बात नहीं है. It is a side effect. So that is the thing. Give me a thumbs up. That is anti-anabolic effect. Done. That is negative nitrogen. जितने दिन लेंगे उतने दिन protein synthesis नहीं होगा. So it is not lifelong. ना? It is for 5 days, 7 days. So उतने दिन protein synthesis नहीं होगा. That is a side effect. Advani का D. That is diabetes insipidus. So it is not all tetracycline which causes diabetes insipidus. Only demeclocycline, that is group 2. Demeclocycline causes diabetes insipidus. What is diabetes insipidus? Diabetes insipidus is due to deficiency of ADH. You know, posterior pituitary secrete ADH in the blood, and that ADH causes sodium and water retention from the kidney. You know it now. You say yes or no. So this is the pituitary. Pituitary secrete ADH in the blood. So in the blood vessel, this is the ADH. So this ADH goes to the kidney, and from the kidney it do sodium and water retention normally. And this demeclocycline, what it is doing? This demeclocycline tablet, if I am taking, this demeclocycline is inhibiting ADH, antagonizing ADH. So ADH will be deficient. There is no ADH. So there is no sodium water retention. So all the water and sodium is excreted in urine. So patient will have abundant amount of urine. The disease is known as diabetes insipidus. Give me a thumbs up. So I hope these are the basics you already know. So I'm just elaborating it. So it is antagonizing ADH. Not all tetracycline, only one, demeclocycline. So again important, demeclocycline. The fifth one is vestibular toxicity. Advani ka V. So vestibule, you know what is vestibule? So in the ear, we have external ear, we have middle ear. In the middle ear, 3 ossicles are present. You know the name of the 3 ossicles, and this is inner ear. In the inner ear, we have a semicircular, the 3 semicircular canals and the cochlea. These 3 semicircular canals will do the balance. That is known as vestibular apparatus. So vestibular apparatus is present inside the inner ear. That is for balancing, for human balancing. So it is not all tetracycline. Minocycline is vestibular toxicity. So it will damage these semicircular canals and do the vestibular toxicity, and patient will have imbalance or vertigo और चक्कर आएंगे अगर बहुत लंबा कोर्स लिया तो. So tetraminocycline causes ataxia, vertigo and nystagmus because of vestibular toxicity. Done. And if it is done, you have to discontinue the drug. Give me a thumbs up. Increase intracranial pressure. There is no detail of it. Phototoxicity. Not all tetracycline cause phototoxicity. Only D and D. D and D. Demeclocycline and doxycycline. Demeclo is group 2 and doxy is group 3, I guess. Both of them are causing phototoxicity. If I take a tablet of demeclo or doxy and go in the sunlight, my skin will be like this. So a sunburn like reaction will take place. That is known as phototoxicity. Last is teeth. PT teacher ka T hai ye, teeth and bone. Tetracycline form chelates with the calcium. Calcium present at 2 places in human body. Inside my body, calcium present either in my teeth or in my bone. So tetracycline will go towards the calcium and form a chelate in the teeth and the bone. In the teeth and the bone. So Teeth will become brown color. Again, a very important image based question already asked in one of the exam. Not in FMG, I guess, but in another exam, this image based question, it is shown. So side effect of which drug? So you can see the brown colored teeth are there, especially the crown. It is the crown which becomes brown color due to the chylate formation with the calcium of the tetracycline. It is a side effect of tetracycline at the crown. So give me a thumbs up. So LK Advani, liver में क्या होगा? So let me summarize. So liver में क्या होगा? Jaundice and fatty liver. All tetracycline causes. Kidney में all causes Fanconi syndrome except doxy. Doxy is safe in kidney. Anabolic, all of them cause negative energy balance. Diabetes insipidus only Demeclo. Demeclo. Yes, Demeclo. So only demeclocycline causes diabetes insipidus by inhibiting ADH from the pituitary. Vestibular toxicity only caused by minocycline. That is vertigo, tinnitus due to the damage in the vestibular apparatus. Intracranial pressure, all of them causes raised intracranial. Phototoxicity only caused by D&D, doxy and demeclo. And bone and teeth caused by all of them. Give me a thumbs up. I tried hard. I tried hard. Precautions you can leave. So that is the adverse effect. See, LK Advani is a PT teacher. Say the full form, you know the full form. I'm coming on the users. Again, a mnemonic for the users. The mnemonic for the users is in front of you. The mnemonic is vacuum bedroom 2 or vacuum the bedroom. 2 को the भी बना सकते हो यहाँ. Vacuum the bedroom. So vacuum the bedroom, say the full form. So name the organisms or the bacteria which are killed by tetracycline. Name the organisms or bacteria which are specially killed by the tetracycline. So it is Vibrio cholerae. V stands for Vibrio cholerae. A stands for acne, the bacteria for the acne. You know acne is pimples. C stands for chlamydia. U stands for ureoplasma. M stands for mycoplasma. B stands bedroom ka B. B stands for Borrelia. R stands for rickettsia and T stands for tularemia. So I will try it. I will try it. Okay. I will forget it. Okay, I will try. So vacuum the bedroom. This is the mnemonic. Who will help me? Who will help me? So V for Vibrio, A for acne, A की C है, chlamydia, ureoplasma, mycoplasma, tularemia, bordetella, rickettsia. Okay, I have done it. If I can do it, you can also do it. Now learn it like this. These are the bacteria which are killed by tetracycline. Give me a thumbs up. So write the mnemonic. This is another mnemonic. BBC Marvel. Same bacteria are there. So either learn vacuum the bedroom or learn BBC Marvel. Learn only one thing. Don't learn both. So that is the thing. So LK Advani is a PT teacher and vacuum the bedroom. Whatever you say. So I have told you two mnemonics. LK Advani के अलावा कपिल देव बेड भी बताया और vacuum the bedroom के अलावा BBC Marvel भी बताया. So learn only one. Don't learn both. I have told you two. Whichever you like, you can learn. So I'm done with the first chapter. I would like to launch polls here. Give me a thumbs up. Just revise it. So tetracycline is known as tetracycline because it contains 4 rings and it is obtained from actinomycetes. Classification. There are 3 groups of the tetracycline. Group 1, 2, 3. You know the drugs inside it. Spectrum. This is the spectrum. It is a broadest spectrum. Gram positive foci, gram negative foci, gram positive bacilli, gram negative bacilli, spirochetes, rickets, mycoplasma, protozoa, everything. Mechanism of action. It acts on 30S. It inhibits the second step on the A window and it is bacteriostatic. Resistance, you know the 3 mechanisms. Adverse effects, LK Advani is a PT teacher, users vacuum the bedroom. So in just 1 minute, you can revise the whole chapter. In just 1 minute, I can revise the whole chapter on the last day of my exam. I can revise. Give me a thumbs up if you like the way of teaching. Everyone give me a thumbs up. I will come on the second chapter, chloramphenicol. Before that, I would like to launch the polls on tetracycline. Are you people ready? I want thumbs up from everyone. If you are listening, you are not deaf. I guess you are not deaf and you can understand it. You should give the thumbs up so that I will have an understanding that you got my point. Okay. So this is the first. Okay. This is the first poll in front of you. Please read the question and tell me the answer. Write the answer in the chat box first. I will read the question for you. Tetracycline inhibits protein synthesis by inhibiting which step? Read the 4 steps. It is inhibiting step number 2. So what is the step number 2? What is the step number 2? Is it inhibiting initiation step? No. Is it binding to 30S subunit and inhibits the binding of new amino acid tRNA? Yes. So correct answer here is B. You all are right. The correct answer here is B. So inhibiting peptidyl transferase activity? No. Inhibiting translocation? This is the 3rd step. This is the 4th step. No, it is not inhibiting 3rd and 4th step. It is inhibiting 2nd step. So these are the 4 steps. Initiation is 1st, 2nd, 3rd, 4th. So which step it is inhibiting? It is inhibiting step number 2, not 1st, 3rd and 4th. So other 3 options are step number 1, 3, 4. Read them. Read them. If instead of tetracycline, I ask aminoglycoside, answer will be A. If instead of aminoglycoside, I answer the chloramphenicol, answer will be C. If instead of it, if I ask the question erythromycin, answer will be D. So depending on the question, answer will be variable. Give me a thumbs up, everyone. So correct answer here is B. You all are right. This is the next question in front of you. Be fast. Tell me the correct answer. Which of the following tetracycline can be used in renal failure without dose adjustment? Which of the following is safe in renal failure? I have told you LK Advani का K is kidney damage. कौन kidney damage नहीं कराता है? Which of the following do not cause kidney damage? That's why safe in renal failure. Which of the following? Oxytetracycline, doxycycline, demeclocycline or tetracycline? Yes, you all are right. The correct answer here is again B. The correct answer here is B. It is doxycycline which is safest in renal failure. It is safest in renal failure. So correct answer here is B. Very good all of you. This is the next question in front of you. Very easy. Tetracycline inhibits protein synthesis by acting on which ribosome? Which part of the ribosome? You tell me. Is it 30S? It is 50, huh? By mistake. It is 5G नहीं है वो 50 है. 50S or both 30S or 50S or 60S. कौन से राइबोसोम पे एक्ट करता है? So yes, you all are right. Very easy. It acts on 30S. So the correct answer here is A. Very good. You all are right. The correct answer here is A. The correct answer here is A. You all are right. Okay, let me move further. So this is the next question in front of you. The following has maximum propensity for photodermatitis. So it causes phototoxicity, na? LK Advani is a PT teacher. PT teacher ka P is phototoxicity. So which of them causes phototoxicity? I told you very specifically. Phototoxicity is caused by two of them. Which two of them causes phototoxicity? D and D. Demeclocycline and doxycycline. So see the options. So it is doxycycline given in the option. Demeclo दिया नहीं है. Demeclo होता तो वो भी सही होता. So correct answer here is B. Doxy and demeclo both causes phototoxicity. Yes. So the correct answer here is B. Yes, Khushi. Yes, Patel. Everyone is right. Everyone. Correct answer here is B. Very good. Correct answer here is B. This is the next question in front of you. Which of the following is not true regarding tetracycline? So which of the following is not true? Read the options. Which of the following is not true? It is not teratogenic. It is true. It is not teratogenic. It causes tit discoloration. I guess it is also true. It causes tit discoloration. It results in superinfection and it leads to pseudomembranous colitis. Pseudomembranous colitis can be caused by all antibiotics. So tetracycline is one of them. सुपर इन्फेक्शन भी हो सकता है. टिच डिस्कलरेशन तो होता ही है. इट इज नॉट टेराटोजेनिक, ही गलत है. इट इज टेराटोजेनिक आल्सो. साइड इफेक्ट्स में ऐड कर लो. LK अडवाणी इज अ PT. टी से दो चीजें कर लो, टिथ भी और टेराटोजेनिक भी. मॉडिफाई योर साइड इफेक्ट्स. टिथ डिस्कलरेशन भी कर लो उससे. टी से टिथ एंड बोन डिस्कलरेशन चिलेशन और टी से ही टेराटोजेनिक भी कर लो. इट इज टेराटोजेनिक. यू कांट गिव टेट्रासाइक्लिन टू अ प्रेग्नेंट फीमेल. You can't give. It is teratogenic. So T से दो वहां पे ऐड करके हो, मैं भूल गई वहां बताना. Just modify your notes. So go back and modify it. So that is done. Should I move ahead? This is the next question in front of you. Which antibiotic should not be given after drinking milk? Milk से. In India ना, we have patients have mentality. Whatever drugs I prescribe to my patient ना, usually patients say, okay, doctor sahab, I will take it with the milk. Why you will take it with the milk? Not all drugs have to be taken with the milk. Which drug you will contraindicate? Don't take it with milk. Which among them? Which among them? The options are chloramphenicol, tetracycline, erythromycin and sulfonamide. So yes, you all are right. The correct answer here is of course tetracycline. Why? Because milk contains calcium, and if you take tetracycline with a glass of milk, tetracycline will form chelate with the calcium present in the milk and it will be inactivated. It will not show its action because it will chelate. So never take tetracycline with milk. You have to warn your patients. And iron also. Yes, iron also forms chelates with the calcium. So don't take iron tablet with milk. So that is the thing. So correct answer here is B. Correct answer here is B. Let me move to the second chapter, chloramphenicol. So I have to teach you 4 chapters today. So second chapter, chloramphenicol. Time is limited. Be fast. So tetracycline is done. Coming on chloramphenicol. I will continue my table. Why chloramphenicol is known as chloramphenicol? Tetracycline is obtained from actinomycetes. I have told you it is obtained from actinomycetes. You have written in introduction. Chloramphenicol is obtained from Streptomyces venezuelae. It is a bacteria. Name of the bacteria is Streptomyces. Sorry, it is a fungus. It is not a bacteria. It is a fungus. Streptomyces venezuelae. That is the name of the fungus. You have to learn it. Streptomyces venezuelae. And it needs to be protection from light. So that's why it is kept in a brown bottle. It has a nitrobenzene in it. Nitrobenzene moiety. You can see nitrobenzene moiety in the structure. So you know there is a nitrobenzene moiety in the structure and it is obtained from Streptomyces venezuelae. It has a 4 rings tetracycline and it is obtained from actinomycetes. Compare the introduction. Coming on classification, there is no classification, only single drug chloramphenicol is there. So you can skip the classification. Coming directly on spectrum. Spectrum is exactly same. Exactly. It is also a broad spectrum. So spectrum is exactly same. It is against gram positive cocci, gram negative cocci, gram positive bacilli, gram negative bacilli. So spectrum is same. Classification is not there because only single drug is there, chloramphenicol. You have compared the structure, compared the classification, compared the spectrum. Coming on mechanism of action, who will tell me mechanism of action of chloramphenicol? Who will tell me which step it is blocking? There are 4 steps. Now, step 1, 2, 3, 4. I'm sorry. There are 4 steps. Now, which step? Just a second. My video, my chat is gone. I can't see your chat. Okay, now I can see. I'm sorry. So, name the, which step it is blocking? I'm asking the mechanism of action. Name the exact step which is blocked by the chloramphenicol. Yes, it is blocking the step number 3. It is blocking step number 3. So, in mechanism of action, you can see step number 3 is blocked by chloramphenicol. That is, it is inhibiting peptide bond formation between the newly attached and the pre-existing peptide chain, and it is inhibiting P to A transfer. P to A transfer. You know P to A transfer. So pre-existing and new के बीच में bond बनने को रोकेगा. Inhibit peptide bond formation between the two, and after bond formation, the transfer of the pre-existing to the new one, that is P to A window transfer. P to A window transfer is blocked by chloramphenicol. So that is the thing. That is the thing. So it is acting on 50S, not on 30S. It is acting on 50S. 50S ribosome के through act करेगा. It will come, act on 50S ribosome and inhibit this step, the third step. And it is bacteriostatic. Again, it is bacteriostatic. Give me a thumbs up. Give me a thumbs up. Give me a thumbs up. So see, the tetracycline was inhibiting 30S. It is inhibiting 50S. The tetracycline was inhibiting the step number 2. That is, it is acting on A window and inhibiting the binding of new tRNA to the A window. Here, second step is not inhibited. After that, the third step is inhibited. That is peptide bond formation between the new and the old, and shift from A to P window. And this was also bacteriostatic. This is also bacteriostatic. Both of them are bacteriostatic. Give me a thumbs up. Everyone give me a thumbs up. Everyone. Listen, one more thing. This chloramphenicol, I am a human body. Inside me, some bacteria is present. For that, suppose I am taking a tablet of chloramphenicol by mouth. So chloramphenicol will go in my stomach, intestine. It will be absorbed in my blood. From the blood, where it will go? From the blood, where it will go? So this is a tablet of tetracycline. This is my blood. From blood, it will go. This is a blood vessel. Let me draw a blood vessel. This is a blood vessel. From the blood, it will go to my cell, human cell also, and bacterial cell also. This is human cell and this is bacterial cell. So this is protein synthesis inside my ribosome, and this is protein synthesis inside bacterial ribosome, and this is the drug chloramphenicol. So chloramphenicol will go inside here also and inside here also. So the thing is that chloramphenicol inhibit protein synthesis in human also at a much greater extent as it is bacterial. Bacteria में protein synthesis कर रहा है, it is good for us. But humans में bone marrow में protein synthesis inhibit होता है, bone marrow में. So patient will have pancytopenia because bone marrow synthesize RBC, WBC, platelet. So if someone takes a tablet of chloramphenicol, the side effect is pancytopenia. That is the biggest side effect. That's why chloramphenicol is banned nowadays. It is not at all used. The biggest side effect is pancytopenia. Why it causes pancytopenia? Severe pancytopenia. RBC, WBC, platelet, all of them reduced in number because they are formed in bone marrow. In bone marrow, highly dividing cells are there. Hematopoietic stem cells are highly dividing. If protein synthesis inhibition takes place in them, they will not divide. They will not divide. They will not form RBC. They will not form WBC. They will not form platelet. Patient will have pancytopenia. The biggest side effect is bone marrow suppression. It inhibits mammalian protein synthesis also. Along with bacterial, it inhibits mammalian. Mammalian means human protein synthesis as well, in the bone marrow especially. That's why patients have pancytopenia. That will be the biggest side effect. Resistance, the same 3 mechanisms. You know the same 3. Either the influx को decrease करो और efflux को increase करो. Protect the ribosome with a protective covering. Number 2. And form enzymes which will degrade the chloramphenicol. Chloramphenicol enzyme. So the same 3 mechanism. Give me a thumbs up. The same 3 mechanisms are there resistance के. So resistance के तो same 3 mechanism है. Adverse effect. I will give you a mnemonic for adverse effect. So adverse effect का mnemonic है big. B-I-G. Big. Super hyper. Big super hyper. Super hyper. So B. Big ka B is bone marrow depression, which is causing pancytopenia. The biggest side effect, pancytopenia. That's why it is not used nowadays. It is almost banned. I is irritative effect. Like if I take it by mouth, I will have vomiting. If I take it, vomiting, diarrhea. If I take it by injection, I will have pain. So local irritation, local irritation. G, big ka G is gray baby syndrome. I will explain you what is gray baby syndrome. Gray baby syndrome is caused only by one drug, chloramphenicol. Never forget. Very important MCQ. Super hyper. Super से super infection. Hyper से hypersensitivity. Hypersensitivity is allergy. So tell me the full form. Tell me the mnemonic of adverse effect. Big super hyper. Big super hyper. Just a second. My chat is gone. Can I see it? Let me see if I can see your chat. Okay. Just a second. Okay, I can see it. Okay. So what is the full form? What is the full form? Big say bone marrow suppression. I say irritative effect, irritative local effect. J say gray baby syndrome. Super infection, hypersensitivity. Give me a thumbs up. Everyone give me a thumbs up. Everyone. So that is the mnemonic. That is the mnemonic. Bone marrow depression. I have already explained you. Patient will have pancytopenia, anemia. WBC will decrease agranulocytosis and thrombocytopenia. So that is the thing. So bone marrow depression, irritative effects, gray baby syndrome. What do you mean by gray baby syndrome? If you give chloramphenicol to neonate, any less than 1 month baby, chloramphenicol to any neonate, it is contraindicated in neonate. Huh? By mistake, if you have given chloramphenicol to any neonate, what will happen? Chloramphenicol will go inside the body of the neonate, but inside the body of the neonate, liver is premature. Liver is premature and liver cannot excrete, cannot do the metabolism of chloramphenicol. So chloramphenicol will not be metabolized. It will remain in the body for a longer time. It will cause toxicity. It will cause toxicity of multiple organs. So baby will stop feeding, baby will vomit, baby will be hypotonic, hypothermic, distended abdomen, respiration will be irregular. That's why baby will look blue, cyanotic. Now it is a misnomer. Baby is looking blue, but it is known as gray baby syndrome. Gray baby syndrome, baby is not looking gray, but he is looking blue. So it is always contraindicated in neonates. Give me a thumbs up. Super infections are there, hypersensitivity is there. Have you got it? So big super hypersensitivity. LK Advani, PT teacher, you know the full form? Yes, you know. Big super hyper, you know the full form? Yes, you know. So let me come on the uses. I will tell you mnemonic for uses also for chloramphenicol. So what is the mnemonic? The mnemonic, first of all, it is not used at all. Very rarely it is used because of this problem. Bone marrow toxicity or pancytopenia, uses are very less. We have restricted the use. Now where you have to restrict the use because of fatal toxicity, that is bone marrow toxicity, that is pancytopenia, don't use it. Being a doctor, I am not advising you to give chloramphenicol to any of your patient unless until no other option is available. So never use chloramphenicol for minor infection. Number one, do not use chloramphenicol if other safer antimicrobials are available at your clinic, at the medical store. If other are safer are available for the same disease, go for that. Don't take the risk. Avoid repeated course. If you are giving it once, okay, once a while it is okay, but avoid repeated course for your patient की बार बार chloramphenicol दे रहे हैं. And if you are giving at all, don't give total dose 2 to 3 grams से ऊपर नहीं जाना चाहिए. It will cause severe bone marrow toxicity. Patient can die. So don't give that chloramphenicol for more than 2 weeks. And total dose daily 2 to 3 grams से ज्यादा नहीं देना है, total 20 grams से ज्यादा नहीं देना है 2 weeks में. So these are the criteria. And monitor blood counts regularly. So if you give chloramphenicol to a patient, ask the patient to do CBC daily. Daily he has to do CBC. If you see RBC, WBC, platelet count are decreasing, stop the treatment. Stop the treatment. It is banned in India. In combined formulation, it is banned in India. So what are the uses? The uses is very rare bare TB. The mnemonic is bare TB. So B stands for bacterial meningitis और pyogenic meningitis. B से bacterial या तो उसको M बना दो. Bare TB को मेयर बना दो. Make it मेयर. B से कैसे याद आएगा? Rubbish mnemonic. Okay, Mayor TB. I'm making new mnemonic. Mayor. Mayor M से I will remember meningitis. So it is bacterial meningitis or pyogenic meningitis. A से anaerobic infection. R से rickettsia. E से ear and eye infection. T से typhoid and B से brucellosis. So Mayor TB. Mayor TB. Give me a thumbs up. So the mnemonic is Mayor. Mayor को Mayor बना दो. B से bacterial meningitis याद नहीं आएगा. तुम्हें brucella, bordetella लगेगा. So make it M. M से meningitis जरूर याद आएगा. So Mayor TB. So it's your wish, whatever you are using. So till now I have given you 4 mnemonics. LK Advani, PT teacher, vacuum the bedroom. These are side effect and uses for tetracycline. Big super hyper and Mayor TB. These are the side effect and uses of chloramphenicol. Everyone give me a thumbs up. Should I come on the third chapter? Should I come on the third chapter, aminoglycoside? Before that, I would like to launch polls for chloramphenicol. Are you people ready for the polls? Should I launch polls? Okay. So the polls are in front of you. Very easy question. A baby question. Very easy. Gray baby syndrome is caused by. Gray baby syndrome is caused by. The 4 options are in front of you. Yes, fast. Gray baby syndrome is caused by So yes, of course, you all are right. The correct answer here is B. It is caused by chloramphenicol. The mnemonic is big super hyper. So big ka jo G hai, that is gray baby syndrome. You all are right. The correct answer here is B. Should I proceed ahead? Should I proceed ahead? Say yes. Okay, so this is the next question in front of you. This is okay. Only one question was there. I'm sorry. So this is the next chapter. I am starting aminoglycoside. So the third chapter I am starting here is aminoglycoside. Write the introduction. Why aminoglycoside is known as amino and glycoside? Amino because it is an amino group, and glycoside because it is having an amino sugar which is glycosidically linked with the amino group. So this is the aminoglycoside. Write the structure in the introduction. Write the structure, compare the structure. Coming on classification, very important. Make 5-star important. So there are two types of aminoglycosides, systemic and topical. Systemic, which are in the form of injections. It is never oral. It is always injection. It is always in the form of injection. And topical is it in the form of the drops, usually eye drops. So it is not tablet. Aminoglycoside के tablet आते ही नहीं है. Either injections or drops or eye drops. So systemic में कौन-कौन से हैं? There are 8. There are 8 you have to learn. First learn topical. Topical only 2 are there. Neomycin and framycin. Neo and fra. Learn. These are 2 eye drops. Neomycin, framycin. Systemic there are 8. Streptomycin, gentamicin, kanamycin, tobramycin, amikacin, cecomycin, netlimycin and paromomycin. So there should be some mnemonic now. This is the mnemonic. Mnemonic for systemic. Mnemonic for systemic is TANGS, KP. TANGSS, KP. Total 8 letters are there. Say the full form. So T for Tobra, A for Amica, N for Neo, G for Genta, S for Strepto, another stress, another S, those S है ना, CISO, and K for Kanamycin, and P for Parabomycin. Give me a thumbs up. So TANGS, KP is the mnemonic for systemic, and for topical, what is the mnemonic? NF, neomycin and framycin. So TANGS, KP. Classification of aminoglycosides. There are 2 types of aminoglycosides, systemic and topical. Who will tell me the mnemonic for both? Tell me the mnemonic for topical first. It is NF, neomycin, framycin. Tell me the mnemonic for systemic. TANGS, TANGSS, KP, TANGS, KP. So you know the full form. I'm not saying it again. Give me a thumbs up. Many questions are on classification. Everyone give me a thumbs up. Should I proceed? Classification is over. So write down systemic here. TANGS, KP, total 8 letters are there. Topical only 2 letters. NF, neomycin, framycin. You will never forget now. Many MCQs are coming on it. That's why I'm asking you to learn it. So you know it. So coming on the spectrum. Now spectrum is really very specific. Very specific. It acts against only against gram negative aerobic bacilli. It is not for cocci, neither gram positive nor gram negative. It is not for gram positive bacilli also. Only gram negative bacilli के against active है. वो भी anaerobic नहीं, aerobic. Very specific spectrum. Please learn it and compare it with others. Compare it with tetracycline and chloramphenicol spectrum. Please compare it with the spectrum. So it is for gram negative bacilli. Please learn it. So it is gram negative aerobic bacilli. Should I proceed? Mechanism of action. Who will tell me mechanism of action? Which step? There are 4 steps. Now step 1, 2, 3, 4. Which step is inhibited by aminoglycoside? Yes, the step number 1. Initiation. Initiation is inhibited. So it inhibits protein synthesis by inhibiting that. So it binds. It binds with 30S also, 50S also, and the junction of 30 and 50S. And it inhibits the initiation. Initiation गलती से हो भी जाए तो misreading होगी. There will be misreading. You know misreading. Misreading का meaning क्या होता है? What is the meaning of misreading? Okay. So if codon is something else and some another amino acid, if AUG is there, AUG stands for methionine. Instead of methionine, proline is coming. That is misleading. So either initiation ही नहीं होगा और initiation हो भी गया तो misreading होगी. So it will lead to misreading. And it binds to 30S also, 50S also, and the junction of 30 and 50S. Number 2. And it is bactericidal also, bacteriostatic also. So this is you have to write. So please compare it with others. Everyone. The tetracycline acts on 30S. Chloramphenicol acts on 50S. Aminoglycoside acts on 30S, 50S, and the junction of 30 and 50S. Done. Tetracycline inhibits step number 2. Step number 2. Yes. Chloramphenicol inhibits step number 3. And aminoglycoside step inhibits step number 1. That is inhibit initiation and misreading. Done. Done. Give me a thumbs up. Give me a thumbs up. Tetracycline is bacteriostatic. Chloramphenicol is also bacteriostatic. But aminoglycoside is bacteriostatic as well as cidal. इससे easy क्या बताऊं? कैसे बताऊं? इससे easy नहीं हो सकता. I can't simplify more than this. This is the limit. Done. So coming on resistance, the same three mechanism. You always know. I'm not reading again. So the same three mechanism of resistance here also. Coming on adverse effects and uses. So adverse effects. I'm having a mnemonic for adverse effect, I guess, but I don't have mnemonic for uses. Okay. So aminoglycoside adverse effect. The mnemonic is on. O double N on. On off wala on. So on HT, on HT. However you remember, the mnemonic is O double N HT. O for autotoxicity, Kanka toxicity. O for auto, N for nephrotoxicity. So make a ear here. This is the ear. This is the kidney, nephrotoxicity. N for neuromuscular toxicity, hypersensitivity and teratogenic. Teratogenic. Don't give it in pregnancy. Teratogenic. I will explain you a little bit. Autotoxicity. Autotoxicity. Let me make a ear. This is the external ear. Pinna. This is the middle ear. And this is the inner ear. Inner ear has a cochlea. Cochlea and three semicircular canals. So, external ear, middle ear, inner ear. Inner ear has two things. Inner ear has two things. Number one is cochlea. Cochlea is responsible for hearing. Cochlea. And these are the three vestibules. Three vestibules are responsible for balancing. So, cochlea is responsible for hearing and vestibule is responsible for balancing. So ear is the organ. Usually you don't know this thing. Ear is responsible for two things. Number one, hearing, and number two, balancing. So we have two apparatus, cochlear apparatus and vestibular apparatus. If I am saying that aminoglycosides are toxic, are autotoxic. Aminoglycosides are autotoxic. So which autotoxicity? Cochlear toxicity ki vestibular toxicity? Both toxicity. So whenever you say anything is autotoxic, now always mention kaun si toxicity hai. Autotoxicity mein cochlear hai ki vestibular hai? Dono mein se kaun si hai? Here both. Aminoglycoside are both toxic. The thing is, cochlear toxicity is permanent and vestibular toxicity is temporary. So if you give aminoglycoside to your patient at little bit higher dose, na, patient will become deaf because of cochlear toxicity and he will be permanent deaf. If you stop the treatment, then also it will not be reversed. It is permanent deafness. Patient will kill you. Doctor, you have done me deaf by both ears, not by single ear. By both ears, patient will be permanent deaf. So don't give an aminoglycoside at a higher dose. It is risky. Number one. And it is vestibular toxic. Patient will have vertigo, but it is reversible. You stop the treatment, it will reverse. So both toxicity is there. Let me check. Yes. So vestibular toxicity as well as cochlear toxicity, both are there. Vestibular toxicity is irreversible and it is due to cochlear damage. Cochlear maybe, this is the cochlea. Let me draw the cochlea. Cochlea में two types of hairs are there, hair cells, outer and inner. So outer hair cells are damaged from the base to the apex. You know, base and apex. So this is cochlea 2.5 tons. 2.5 ton होते हैं cochlea में. You know it. Yes. So base. This is the base and this is the apex. So it start from base. The toxicity start from the base towards the apex. And outer hairs are damaged, being specific. Outer hairs and it is permanent. The deafness is permanent. And vestibular की वजह से headache, dizziness, nausea, vertigo होगा and it is temporary for 6 to 10 weeks. Give me a thumbs up. So both toxicities are there. That is autotoxicity. So never give aminoglycoside with other drugs which causes autotoxicity like furosemide, cisplatin, vancomycin and amphotericin B. So these are the 5 drugs. 4 these and the 5th one is aminoglycoside. 5 drugs which are toxic for ear. So learn the list of 5 drugs which are toxic for ear. So that is autotoxicity. Coming on nephrotoxicity. So it will kill the brush border of the kidney and that is reversible. That is reversible. So never give aminoglycoside with other drugs which are nephrotoxic like amphotericin B, cisplatin and cyclosporin. So that is the thing. So autotoxic हो गया, nephrotoxic होगा, neuromuscular blockage की वजह से patient will have weakness. Patient will have weakness because of decreased release of acetylcholine at the junction of neuromuscular blockage. Hypersensitivity is there, teratogenic is there. If you give tetracycline tablet to any pregnant lady, जो होने वाला fetus है, the fetus will be deaf by birth. Deaf by birth. Permanent. बच्चा पैदा ही deaf होगा. So it will be like Burfi. So it will be, deaf by birth. So that is teratogenic. So never give tetracycline to any pregnant lady. Done. Should I proceed? So on OT is the mnemonic. Have you got it? Give me a thumbs up. Everyone give me a thumbs up. So on OT is done. Coming on uses of aminoglycoside. Uses के लिए I don't have any mnemonic. You have to learn it by your own. All gram-negative infections, because it is effective only for gram-negative bacilli, that is aerobic. So gram-negative bacilli वाले infection, learn the names. For TB is also a gram-negative bacilli. For intestinal sepsis, for intestinal amoebiasis and topical application in the eye. Topical application. So uses you have to learn by your own. Coming on the last chapter, erythromycin. Before that, I would like to launch polls for aminoglycoside. Are you people ready for the polls? Give me a thumbs up if you people are ready for the polls. Everyone give me a thumbs up if you people are ready for the polls. So I'm starting with a, okay, dose regimen. As I told you, it has a narrow, before coming on that, I would like to add one more thing here. Dose regimen. It is a dangerous drug. Now, if we increase the dose by a little bit, patient will be deaf and nephrotoxicity, autotoxicity will be there. So doses is fixed. It has a low safety margin. It is a low safety margin. So doses are fixed. So read the doses for Genta, Tobra, Ciso, and Netlimycin. The dose is 3 to 5 milligram per kg per day. If the patient is 50 kg, so 50 into 5, so it is 250 milligram. It is like this. Streptomycin, kanamycin, amikacin, it is 7.5 to 15 milligram per kg per day. So that is the maximum dose you can offer to your patient. And these are the one-liners. Learn the one-liners by your own. So most commonly used among these is gentamicin. Maximally effective against pseudomonas is tobramycin. So you have to learn by your own these one-liners. I would like to launch polls on aminoglycoside. Then I will move on the last chapter for today, erythromycin. Are you people ready? Should I launch the polls here? Say, give me a thumbs up. Say something. Should I launch the polls here? Yes. So this is the first poll in front of you. Be fast. This is the first poll in front of you. Mechanism of action of streptomycin. Who will tell me mechanism of action of streptomycin? Streptomycin is a aminoglycoside. It is a aminoglycoside. It inhibits which step? It inhibits step number 1. So steps तो पूछी नहीं है. It inhibits translation, inhibits signal transduction, inhibits citric acid cycle, or inhibits mitochondria. Very funny question and easy question. So it inhibits translation of protein synthesis. Which step of translation? Step number 1. So correct answer here is A. You all are right. Correct answer here is A. So correct answer here is A. You all are right. Very good. Very good. This is the next question in front of you. Be fast. Which of the following aminoglycoside is not available for parenteral use? Not available for parenteral use. So it is based on classification. I have told you systemic and topical. So systemic are parenteral, topical are non-parenteral. So in short, they are asking which of the following is topical. In topical, I have told you only 2 are there. In topical, only 2 are there. Which 2? Which were the 2? I just forgot. Okay, and left. Neomycin and framycin. So see the option. So framycin is there in the option. So correct answer here is C. It is not used for parenteral availability because it is used for topical. It is used for topical. So indirectly questions are asked. So correct answer here is framycin. If instead of framycin, neomycin is also there, that will be also my answer. So correct answer here is C because it is topical one. Yes, you all are right. Very good. This is the next question in front of you. Aminoglycoside causes hearing loss by damaging what? By damaging what? So it damages cochlea, everyone knows. So cochlea has 2.5 ton. Let me see. This is 1 ton, the half ton, 1 ton. Okay, one more. This is 2.5 ton, 2.5 ton. So this is the base. This is the base. Let me see. This is the base and this is the apex. So these are the hair cells. There are 2 types of hair cells, inner, outer, inner, outer. Which hair cells are damaged by aminoglycoside? And basal ki apical? Basal cells are damaged first or apical? I have told you very specifically, it kills outer cells, not the inner cells. Outer cells start from the base, then towards the apex. So damage start from the base and damage go towards apex. So base. So correct answer here is B. Outer cells of the base. Give me a thumbs up, everyone. Correct answer here is B. Correct answer here is B. That is given in my notes. I have told you this also. So correct. That is causing cochlear toxicity. So the base is responsible for high frequency sound and apex is responsible for low frequency sound. So patient have hearing loss first for high frequency sound and gradually the patient will have low frequency sound deafness also gradually when apex is destroyed. That is the thing. So correct answer here is B. Everyone give me a thumbs up. Everyone give me a thumbs up. This is the next question in front of you. Which of the following is a side effect of streptomycin? First learn what is streptomycin. You should understand streptomycin is a aminoglycoside. Aminoglycoside, and what is the side effect? The mnemonic for side effect is on HT. Now see. So on HT mein autotoxicity is there, but hepatotoxicity and phototoxicity is not there. Hepatotoxicity and phototoxicity were the side effect in Alke Advani is a PT teacher. So these are the side effects of tetracycline, but not streptomycin. So the correct answer here will be C. Yes, you people are right. The correct answer here will be C, not all of the above. Not most of the students, when all of the above is given in the option, it is not the thing कि all of the above सही answer है. Most of the students have this mentality कि मैम all of the above है तो वही सही होगा. No, it is not necessary. Examiner wants to confuse you. That's why he has given an option all of the above ताकि तुम tempt हो जाओ. You will have a strong temptation. Yes, all of the above is the correct answer. But you have to resist your temptation and then you have to see what is the correct answer. Don't get tempted in your exams, right? So the correct answer here is C. You have to apply your knowledge. Don't get tempted there. So correct answer here is C. So C is the correct answer. Let me move ahead. This is the next question in front of you. All of the following are administered orally except which drug is never given orally. Oral available ही नहीं है. Either injections are available or drops, topical use is available. So which of the following drug is this? So ciprofloxacin, cotrimoxazole, gentamicin or amoxicillin. So gentamicin is the aminoglycoside and aminoglycosides are not available orally. Either they are available injectable form, that is systemic, or they are available in the form of drops. So aminoglycoside की tablet आती ही नहीं है. Amoxicillin is a penicillin. Penicillin की tablets are there. Cotrimoxazole कल ही पढ़ा ना. It is a combination of sulfonamide and trimethoprim. Yesterday we have studied it. So tablets are available in 5:1 ratio. I have told you yesterday. Ciprofloxacin is a cephalosporin. So tablets are available. You know. So gentamicin, there is no tablet available because it's an aminoglycoside. Aminoglycoside either comes in injectable form or topical form. Give me a thumbs up. I'm trying my best. So correct answer here is C. Correct answer here is C. Should I move ahead? Everyone give me a thumbs up. This is the next question in front of you. Widest spectrum aminoglycoside. I have told you this in one-liners. Widest spectrum aminoglycoside. So correct answer here is B. Most of the aminoglycosides are active against only gram-negative bacilli. But amikacin is active along with gram-negative bacilli for other bacteria also. So learn it. In one-liners it is given. So correct answer here is amikacin. So correct answer here is amikacin. Which of the following is the side effect of streptomycin? Which of the following is the side effect? It is a repeat question, I guess. Correct answer here is C. No? I have told you. Okay. Okay. So what is true about aminoglycoside except? Question contains except, which is not true about aminoglycoside. Read the four options. The four options are in front of you. Please read. Is it bacteriostatic only? Or is it distributed extracellularly? Is it excreted unchanged in urine? Is it teratogenic? So as per my knowledge, I know it is teratogenic because on HT, T is teratogenic. It is teratogenic. It is distributed extracellularly and it is excreted unchanged in urine. These are also right options. Although if you don't know these, you know along with bacteriostatic, it is bactericidal also. So this option is incorrect. It is not only bacteriostatic. Along with bacteriostatic, it is bactericidal also. So incorrect among them is A. That's why A is our answer. Which of the following is highly vestibulotoxic drug? Vestibulotoxic means the one which destroys semicircular canals in inner ear and causes vertigo and imbalance. So aminoglycosides are cochlear toxic and vestibular toxic. Both toxic, that's why autotoxic. So on HT में write like this. On HT में जो O है उसको cochleotoxic और vestibulotoxic दोनों कर दो. So you will never forget जो O autotoxic है वो दोनों toxicity है. So vestibulotoxic are aminoglycosides. So which among the following is the aminoglycoside? Streptomycin is the aminoglycoside. So the correct answer here will be B. Yes, Khushi, you are right. You all are right. The correct answer here is B. So cisplatin, cotrimoxazole, and quinine. These are cisplatin is the autotoxic. It is cochleotoxic but not vestibulotoxic. So you should know the list of the drugs which are cochleotoxic, which are vestibulotoxic, and which are both. Only aminoglycoside is both. Only aminoglycoside is both. So correct answer here is B. This is the next question in front of you. Neurological transmission is affected by. So I'm asking about neuromuscular blockage. Neuromuscular toxicity is caused by which drug? It's caused. The options are sulfonamide, nitrofurantoin, isoniazid, antitubercular drug, and streptomycin. So streptomycin is the aminoglycoside and the side effect of aminoglycoside is on HT. So autotoxic, nephrotoxic, the another is neurotoxic. It is neuromuscular transmission को भी affect करता है. So answer is streptomycin. So the correct answer here is D. So if you know the mnemonics, now questions will be really very easy for you. Very easy for you. So I'm done with the third chapter also. Till now we have covered 3 chapters. Tetracycline, chloramphenicol, aminoglycoside. I'm starting the last chapter, macrolide antibiotic, also known as erythromycin. It will take 10 more minutes. Are you people ready or should you read by your own? Should I end the lecture here? Write down in the chat box. Do you want me to continue right now for 10 or 15 more minutes? Or I will provide you the notes, you read by yourself. Comparatively here, it is easy. Okay, you want me to continue. Okay, so macrolide. I will tell you the classification. The prototype drug is erythromycin. So why it is known as macro? Macro means big. Because see the structure, it is having a big ring, large ring. It is known as macrolide because of the macrocytic lactone, big ring. lactone ring with attached sugars. You can see multiple sugars are attached with attached sugars. So see the structure. It is having a macrolide ring with multiple sugars. That is coming on classification. There are 5 drugs: erythromycin, roxithromycin, clarithromycin, azithromycin, spiramycin. So among them, the prototype is erythromycin. So ERCAS. So that is the mnemonic. And nowadays, tacrolimus, it is an immunosuppressant drug. It is not an antibiotic. These 5 are antibiotics. But tacrolimus is an immunosuppressant drug that is also included in this class. So again, a very important MCQ. Which of the following immunomodulator is a macrolide? So the answer is tacrolimus. So total 6 drugs are there. So you can write like this. So total 6 drugs are there. So you know the full form: erythromycin, roxithromycin. You know the full form: erythromycin, roxithromycin, clarithro, azithro, spira. Clarithro, azithro, spiramycin, and tacrolimus. So these are the classifications. So learn the classification of all drugs and compare it. Compare the structure of all. Compare the classification of all. Now coming on spectrum. You know, spectrum is a fun here. Learning spectrum. So tetracycline was a broad spectrum acting against all 4. Gram positive cocci, gram negative cocci, gram positive bacilli, gram negative bacilli. You see, yes ma'am, we know it. Chloramphenicol, same spectrum, acting against all 4. Gram positive cocci, gram negative cocci, gram positive bacilli, gram negative bacilli. You say, yes ma'am, we know this also. Okay. Aminoglycoside among them acts against only gram negative bacilli, not against rest of the 3. तो रेस्ट ऑफ द 3 को बुरा लग गया कि अमाइनोग्लाइकोसाइड तो सिर्फ ग्राम नेगेटिव बेसिलाई के अगेंस्ट एक्ट करता है, हमारे अगेंस्ट एक्ट नहीं करता है. सो रेस्ट ऑफ द 3 के अगेंस्ट सिर्फ इरिथ्रोमाइसिन और मैक्रोलाइड एक्ट करेगा. सो ग्राम पॉजिटिव कोकाई, gram negative cocci, and gram positive bacilli, not gram negative bacilli. So here is the spectrum. Give me a thumbs up. Give me a thumbs up. That is the spectrum. Give me a thumbs up. So that is the spectrum. So let me start with erythromycin. Erythromycin is obtained from a fungus. Name of the fungus is Streptomycin erythraeus. That's why known as erythromycin. That's why known as. So write the name of fungus here of all of them, from where they are obtained. Write the name of the fungus in introduction. Spectrum, I have told you there are 3 things: gram positive cocci, gram negative cocci, and gram positive bacilli. It is not gram negative bacilli. So please see here. Compare the spectrum. I advise you, many MCQs are on spectrum. Compare the spectrum. See the spectrum of tetracycline, all 4 are there. See the spectrum of chloramphenicol, all 4 are there. See the spectrum of aminoglycoside, only gram negative aerobic bacilli are there. And see the spectrum of erythromycin, instead of gram negative bacilli, rest 3 are there. Gram positive cocci, gram negative cocci, and gram positive bacilli. I hope you liked it. Give me a thumbs up if you like it. Give me a thumbs up. Now you people tell me what is the mechanism of action. Which step it is inhibiting? So tetracycline is inhibiting step number 2. Chloramphenicol is inhibiting step number 3. Aminoglycoside is inhibiting step number 1, initiation. So step number 4 hi bacha na. So step number 4, the last step is inhibited by erythromycin or macrolide, that is translocation. So it inhibits protein synthesis. Which step? P to A transfer. It is inhibiting P to A transfer, that is translocation. Translocation of the ribosome. Ribosome translocation is inhibited. So last step, the whole ribosome is moving left flip-flop. That step is inhibited, and it is bacteriostatic. So it is acting on 50S. Now compare the S. Tetracycline acting on 30S. Chloramphenicol acting on 50S. Aminoglycoside acting on 30S also, 50S also, and junction also. And erythromycin again acting on 50S only, like chloramphenicol. Compare it, please compare it, please compare it. See the step you already know. See static and sidal. Tetracycline is bacteriostatic. Chloramphenicol also bacteriostatic. Erythromycin also bacteriostatic. Only bactericidal is aminoglycoside. That is static के साथ साथ sidal भी है. Give me a thumbs up. I'm really trying hard. Give me a thumbs up. And you know resistance के तो वही 3 तरीके हैं. So leave the resistance. The 3 mechanism you already know. So resistance is common in all of them. You know the 3 mechanism: decrease influx, increase efflux, cover the ribosome with a protective covering, and enzyme formation. Enzyme will degrade the drug. So these 3 mechanisms are common for both. Coming on adverse effect and uses, I will give you mnemonic for both. Adverse effect and uses. Coming on adverse effect of erythromycin. Yeah, here pharmacokinetics is also important. Coming on adverse effect, only pharmacokinetics, make a column of pharmacokinetics. It is not important in the first 3 drugs, but here pharmacokinetics is important. It is acid labile. If I take a tablet of erythromycin or azithromycin, now it will go in my stomach and it will be destroyed, because stomach contains acid. That's why these tablets are enteric coated. The tablet is coated with a covering, protective covering, that will not dissolve in acid. So tablet will go in intestine, then it will be dissolved. So if I take this tablet, this is my stomach, this is my intestine. The stomach contains the acid. So if I take this tablet by mouth, so if without enteric coating I am taking it, it will be destroyed in the stomach. And if with enteric coating I am taking, it will go in the intestine and it will dissolve in intestine only. That is enteric coating tablet. So learn the list of the tablets which come in enteric coating form. So erythromycin or azithromycin or macrolides are one of them because they are acid labile. Number one. Number two, it shows enterohepatic circulation because it shows glucuronide conjugation, and erythromycin is the inhibitor of CYP3/4A. You know this mnemonic. Those who are my old student, they know this mnemonic from general pharmacology. I taught you this thing. तो एंजाइम इनिबिटर्स का लिस्ट मैंने तुम लोगों को बताया है. विटामिन के कैन नॉट कॉज एंजाइम इनिबिशन. दिस इज द निमोनिक. यहाँ पे एंजाइम स्टैंड्स फॉर एरिथ्रोमाइसिन. इट इज द एंजाइम इनिबिटर. विच एंजाइम? CYP3/4A enzyme. It inhibits this enzyme. That's why causes the toxicity of the substrate drug. So never give erythromycin with the substrate drug. You know the list of the substrate drug. Done. Coming on adverse effects. Adverse effects. The mnemonic is macro. 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 So M stands for motilin receptor agonist. I will tell you what it is. A stands for allergy, hypersensitivity allergy. C stands for cholestasis, means jaundice. It causes jaundice. RO stands for reversible autotoxicity. Autotoxicity was irreversible in aminoglycoside. Here it is reversible. Reversible autotoxicity. Give me a thumbs up. Give me a thumbs up. So what is the first thing? Macrolide receptor agonist. Listen, this is the intestine. This is human intestine, esophagus, stomach, intestine. The cells of the intestine, the human intestine cells are there. On the human intestine cells, certain receptors are present. Normally inside me, inside you, everyone it is present. The name of this receptor is motilin. Motilin. Normally these are inactivated. But whenever you take a tablet of erythromycin, erythromycin will go and erythromycin will stimulate these receptors. Motilin receptor agonist. These are motilin receptor agonists. So they will stimulate this motilin receptor, and on stimulation it causes peristalsis. So patient will have diarrhea. Patient will have diarrhea as a side effect because of motilin receptor agonist. So motilin receptor will be stimulated and it induces contraction, it hastens gastric emptying, and it causes mobility. That's why known as motilin, or causes diarrhea, or it causes epigastric pain. Severe spasm की वजह से यहाँ पे spasm आ जाएगा. So severe spasmodic pain की वजह से epigastric pain और diarrhea will be there. Allergic तो है ही. MACRO, macro. C is cholestatic hepatitis. Patient will have jaundice, especially pregnant females will have, but it is reversible, disappear after the usage. And reversible toxicity, reversible autotoxicity. So MACRO is the mnemonic. So write down macro, you know the full form. Compare the adverse effect mnemonic of all of them. Coming on uses, I will give you a mnemonic for uses also. Uses is CLAW, CLAW. C stands for chancroid, caused by Haemophilus ducrei. L stands for, अच्छा C के दो हैं, double C कर दो. C is Corynebacterium diphtheria and Campylobacter. Triple C कर दो. Triple C. C3 claw. C3 claw. So there are 3 C. Learn all of them. Chancroid, Corynebacterium diphtheria and Campylobacter. L stands for Legionella. CL. A stands for atypical pneumonia and W stands for whooping cough. We know whooping cough is caused by Bordetella. Give me a thumbs up. Give me a thumbs up. These are the one-liners. Give me a thumbs up. This is our master table. So I would like to launch polls first on erythromycin. The polls are in front of you. This is the first question. Which of the following receptor acts on motilin receptor? So what was the side effect? Side effect was macro. Macro का जो M है, macro का जो M है, that is motilin receptor agonist, and that is caused by macrolides. You know macrolides. There are 5 macrolides. Erythromycin is one of them. So the correct answer here is A. It was a funny question, baby question. Everyone is right. So the correct answer here is A. Give me a thumbs up. Give me a thumbs up. This is the next question in front of you. Erythromycin is given in decreased bowel motility. If some person is having decreased bowel motility, that is constipation, we can give erythromycin to them. Why? How it will help? How it will help in constipation, or how it will help in decreased bowel motility? It increases bacterial count, it decreases bacterial count, it binds to adenyl cyclase, or it binds to motilin receptor. So all of us, we know the correct answer right now. It binds to motilin receptor, stimulate the motilin receptor, it increases the motility and relieve constipation. It can relieve the constipation. So correct answer here is D. We all are right. Correct answer here is D. I'm a little bit faster, huh? Yes, you are right. Yes, you are right, Khushi. So I'm done. I'm done with the 4 main drugs of protein synthesis inhibitor. This is the master table of tomorrow, yesterday also and today also. Today, this was the master table. We have studied 3 chapters today, and yesterday we have studied 3 chapters, and today we have studied 4 chapters. Total 7 chapters are completed from my side in antimicrobials. Give me a thumbs up, everyone. So yesterday's 3 chapters are in front of you: sulfonamide, trimethoprim, and quinolones. I hope the table is present in your copy. Flip the page and see this table. Is it present in your copy? So please revise the adverse effect and uses before going to your exam, and mechanism of actions also. So this is your last day revision. In 1 minute, one chapter. 1 minute, one chapter. 1 minute, one chapter. So in 3 minutes or maximum 5 minutes, I can revise this chapter. These 3 chapters in 5 minutes, and the last day of my exam. In the last day of my revision. So on 12th of December, you have your exam now. From 1st of December, you start revision. You start revision. So you revise these table in the last day of your exam revision. That is the yesterday's class. And today's class, this is the summary. The summary is in front of you. Please be fast. What is the summary? So you see there are 4 drugs. This is the master table: tetracycline, chloramphenicol, aminoglycoside, erythromycin. Compare the structure of all. Compare the classification of all. Compare the spectrum. The spectrum is really very, very important. Being a doctor, you should know the spectrum. Compare the mechanism of action of all. Compare 30S, 50S, 30, 50, both only 50. So which step? Step number 2, step number 3, step number 1, step number 4. And which is bactericidal, which is bacteriostatic. Compare. Resistance you can leave. It is not important. Adverse effect and side effect. How can you forget? How can you forget? Adverse effect, see the mnemonic of all of them. So LK Advani is a PT teacher. You know the full form. Big Super Hyper. You know the full form. On HT. You know the full form. Macro. You know the full form. These are the adverse effect. Uses you already know. Vacuum bedroom 2. That is the full form. बेयर टीबी को मैंने मेयर टीबी कर दिया था. नेक्स्ट टाइम मैं इसको ठीक कर दूंगी. मेयर टीबी, यू नो, यहाँ का निमोनिक मैंने नहीं दिया. यू कैन मेक ऑफ योर ओन. मुझसे कुछ बन नहीं पाया. एंड हियर द निमोनिक इज क्लॉ. यू नो द फुल फॉर्म. प्लीज आज अपने रूममेट को पकड़ो, बैचमेट को पकड़ो, ये टेबल बना दो उनके सामने. यू विल नेवर फॉरगेट. यू विल नेवर फॉरगेट. मैंने तुम्हारे सामने बोल दिया ना, आई विल नेवर फॉरगेट. मैंने तो न्यूमरस बैचेस में बोला है, मेरी बात अलग है. लेकिन तुम, इफ यू से इट वंस ना, यू विल नेवर फॉरगेट. सो दैट इज माय एडवाइस, पर्सनल एडवाइस टू यू. So here I have to stop. Thank you for being with me. Really, thank you. I really enjoyed teaching.